Welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change.
Well, hi, everyone, and welcome to Alzheimer's Speaks. I'm your host, Lori LeBay, and today we are going to be talking with Lydia White, the co-founder of Comfort Keepers in-home care in Southeast Michigan. And that is something I don't think we can talk about enough, the support that is out there for people and how it works and how do you pick somebody, all of those types of things. So before I introduce you to her, I always just like to mention, don't forget to check out Alzheimer's Speaks. We have great information that is all free in our educational resource site, from memory cafes and dementia-friendly communities to Dementia in the Arts, Dementia Chats, more about the radio, our poetry section, tools you can download, etc. And then also our sister company, which is Dementia Map, which is a global resource directory that you can check out as well. And the other thing that you can do is be a giver of hope. Like, click, and share this episode. It's amazing the impact that can have on people that are in need but don't know where to go, aren't sure what to ask for. Just being in your sphere and being connected to someone who is saying this might help is a good idea. Well, Lydia, I am so glad that we connected and we're finally able to pin down a show to do. I think the type of work you do is so critical, and I hear from families all the time that they're confused on what are the services and how do I go about finding someone and how's the cost going to be covered. That's always a spooky thing, you know, whenever we're doing anything, especially in these kind of crazy economic times that we're in. But before we kind of dive into all of that, if you don't mind introducing yourself and just giving our folks a little background about who's Lydia.
Absolutely. Lori, thanks so much for having me. I really appreciate it. I love everything that you're doing. And I love that we can just have these heartfelt conversations about dementia. And it's something that I'll share in a minute that's very close to my heart with my own family. So owned a caregiving business for about 10 years. We have 4 locations. We're located in southeastern Detroit. My background is I was a caregiver 100 years ago when I was a kid. And the reason I got into that is because I wanted to, at a young age, I wanted to do something in the helping profession, whether it was social work, and the basis of that was caregiving, really. And I learned at 19 how to help people do things in their home and physically help somebody get to work every day. And it gave me a nice perspective for the rest of my life on, everybody's different and some people just need a little more physical help. I also, over the course of the years, I'm a certified dementia practitioner. I also have studied with Teepa Snow and am a champion teacher for her. One of the very few champion teachers in southeastern Michigan. There are a lot of types of trainings you can take for Teepa, but the champion teacher is something that I've actually done within my own business, but outside of my business as well, with different organizations such as like hospice organizations, to help people learn how to connect with people first before we start trying to get things done. So, and then in terms of my personal story, this actually kind of hits really hard right now. My grandmother had Alzheimer's, and back 30 years ago, they put people in a nursing home. That's what they did. There wasn't any other place to go. It was a small town in Illinois. That's what they did. And I don't think they really had a lot of tools in their toolbox in order to connect with people, and especially a small town like that. And then I've been watching my mom decline for a little while, and I'm not sure if she'll ever listen to this, but I love her so much, and I've watched her really try hard. But she was just finally diagnosed with Alzheimer's as well. So it runs in the family, and I know my mom struggles. It bothers her a ton. She knows just enough to know she doesn't remember things all the time, and unfortunately, we live far away from each other. So I feel very strongly and passionately about connecting with people before we start to do any type of care. Any client, if they're on hospice, whatever, I always grab for their hand and I let them make the decision if they want to hold my hand or not. It's their decision. They don't get a lot of decisions, so they get to make that decision. 9 times out of 10, they're going to want to hold your hand. But everybody has different days and different abilities and different understandings of the current moment. So that's a little of my background. I don't know if and I'm also completing my RN degree right now as well. I'll be done in August. So I decided I wanted to take my knowledge a little further to understand medications better, to help our clients that are coming out of hospitals and things like that bridge the gap. There's a huge gap between people coming home from hospitals and home care. And we can talk a little bit during our conversation about the home, the continuum of care. You've got healthcare, which is, hospitals, rehabs, subacute rehabs, all those things, all the way to home health care, which is different than what we do, which is home care. And that is the everyday sort of living, assistance with activities of daily living, things like that. So there's a lot of misunderstanding, and I'm constantly I love educating people so that they understand what they're getting and what other opportunities they have to get support.
I loved when you talked about, holding their hand and letting it be their choice. And a lot of family members, especially if their loved ones older, go, oh, they're not touchy feely. They're not going to do that. But we take that choice away when we don't give them the opportunity to decide, because so many of them might have grown up in a family where they weren't hugging, they didn't hold hands, but over the years they've missed that, but they didn't know how to break that. And now all of a sudden you're giving that ability to connect on a different level that they know as they've aged, they've missed out on, because
Right.
that's not how they were raised. I've seen that a zillion times, play out. And I understand with when you explained your mom knowing that she doesn't know. That's probably the most frustrating time of the disease. I know my mom got very angry and just more snappy. And, she was always kind of a bubbly, light personality, but it was so heavy. And then, she pulled away, and instead of being in the thick of things, she became kind of a flower on the side, just kind of watching a wallflower, not wanting to make a mistake, embarrass herself or anyone else. And that's really hard to watch and to understand. But it's really a protection mechanism.
Yeah.
But we don't
Yeah.
frame it like that. We go right away to it's a behavior, and it's like, no, it's a reaction because something's uncomfortable.
I really appreciate that you said that. So sometimes even training some of our administrative folks that work in the office, and all of them have gone through an online, both my in-person TIPA training, and they've also gone through the Alzheimer's Association. We're involved as an organization in Positive Pathways, which is a program that the Alzheimer's Association put out. And it's basically a set of courses that the caregivers can take where, we pay for that, where they take them and learn a positive approach to care. And also a lot more detail about, we say behaviors, but what that really means is an unmet need. My mom too, like she is a very lighthearted, she loves to have fun. She has 10 brothers and sisters. She loves talking to her sisters. She loves a party. She loves family. And, she hasn't gotten snippy, but she does kind of draw back a little bit, probably because she's nervous or doesn't want to say the wrong thing. And it breaks my heart, because she's not feeling comfortable in her own skin. And I think that'll unfortunately continue to happen. But we can do that by connecting with her. And I'm also going to reach out to her sisters and make sure they're still calling her because she repeats herself a lot. So we want to make sure that she's getting the support she needs. And that's the same with everybody in our business. It's the coolest thing in the world to go into a home that I've never been to. And they're like, yeah, my mom doesn't really like to touch anybody. And here's the thing, when we're sick and we don't feel well and we're scared, I would say pretty much anybody would appreciate a hand, a warm hand to hold, and just to talk to them about maybe things they used to like to bring them out. And I absolutely love that. That's my favorite thing in the world to see. And when caregivers can do that, we have professional caregivers and they can do that. It's amazing. They're like, I was able to get Miss Smith to take a shower and she giggled a little bit and we had fun and they know that. They may not be able to articulate that, but they know that this person is here to connect with me and that makes me feel better.
Well,
Hmm.
and that they understand me, because families, is compassionate as we think we are, we don't always come off that way because a lot of times we're
Yeah.
rushed and we have our Stepford wife smile on, like everything's okay, but they can feel all of our anxiety popping out every way from. And so I think there's a big misconception with people with dementia that they can't read all of the signals anymore. And they can. They tell me anyways that actually they read them more, they understand them better than they did before their dementia, because before their dementia they didn't know that they were relying on all of that stuff. They didn't
Hmm.
realize they were reading expressions and gestures and all of those things, and now they know they have to. That's why they always say, look at me when you talk to me because I'm reading your lips and everything else. And that's helping me figure out what I need to do or how I need to respond. And so it's very, very critical. I wanted to talk to you, because you entered in as an owner, and you now have multiple home care agencies, and you're completing your RN degree. So you seem like you're just go 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 go, but you seem to really see the need. What really inspired you? Was there like a trigger point in you that just said, this is the path I want to go? And then it seems like you keep kind of defining it and yet expanding it at the same time.
Yeah, absolutely. So I worked a corporate job in program project management for a long time and really, raising a family and things like that. And I needed to make sure I had something steady. But I would spend, many years even on a project at a corporation level, working on large things there, and they may or may not use the end result of what I worked on. Not me personally, but a team of people. And I don't know, when we decided to open up this business, I started to do training, which I love to do. I started to connect with people right away. And you either connect with somebody or you don't. And especially with clients with dementia, you're absolutely right. They're like fight or flight. So you either have them in a calmer state or they're in that dinosaur brain, which is why they can sense those kinds of things right away. For me, the turning point was I always wanted to do something in the health and human services. I had I had actually considered being a police officer, and then I decided that, oh my gosh, I could never in a million years, actually protect anybody with a gun. So I went through all of that, and then this came up. Somebody in the family said, there's a Comfort Keepers, we're a franchise, and the minute we did it, I knew I had made the right decision. The minute we did it, I started to meet with families, and I thought this is exactly what. But I couldn't have done that with all the other background and business information that I had and my degree and everything. So for me, that's what started it. And then I thought, you know what? I don't know about this. And I thought, we thought about hiring a nurse, and we have before, but the type of nursing you need for home care is a little different than what you need for the hospital. So, we we've hired nurses over the course of the time, and we actually can provide private duty nursing. But I thought, why not just become a nurse? Because I wanted to do that anyway. And, I now have the opportunity. The business has afforded me the time and the space to do that to some degree. It's not always easy, but I'm finishing up soon. So it's the light at the end of the tunnel. I wouldn't trade it for the world. It feels like exactly like the right place to be. Also, with just having my mother and my grandmother to keep in mind, I also experienced the same thing you're speaking of, where families are frustrated. They're trying to take care of somebody. They don't have a lot of tools in their toolbox. And a lot of people say patience, right? Patience is not really the issue. It's the skills to handle connecting with someone in a different way so you can help them get the job done. Tipa always says, know your agenda, but don't show your agenda. And my passion, I love to learn and I love to teach people, and I love to teach caregivers like different ways of doing things that helps them not to be burnt out as well. Because if we can stop a little bit of that burnout and actually give them some sort of a ladder and skills to build, we're going to have people that are able to take care of people a lot better and not also burn themselves out, which is what happens.
Oh,
So,
yeah.
mhm,
That makes a lot of sense. I always say we have to shift from a mindset to a heart set. In the beginning, my mom lived with dementia for 30 years.
mm,
And the doctors kept saying, "Oh, there's no way, there's no way." And then upon autopsy, they're like, "Oh my gosh, you were right." She not only
mhm,
had Alzheimer's, but she had Lewy body, and she had Parkinson's, which we were never ever told. But there's just this disbelief sometimes in what the family sees to be able to get instruction from who you need. And so for me, my goal was always to shift dementia care, and actually care in general for all ages, from crisis to comfort.
mhm.
Instead of, but when we're in that crisis mode, we're not coming off calm. We're not coming off centered. We all know if we're dealing with a kid, they're going to mirror us back.
Right,
So if we're wild or we're tense, they're coming right back at us with that. And yet
right.
we don't apply that. And so I just think it really is so much about setting up, um, changing our perceptions of what this disease is. And it's just
Mhm.
another thing to adapt to. All of our lives we've been adapting, and then dementia hits and we're like, nope, we're staying put. And it's like,
Right,
no, it does not work that way, or it doesn't work well that way.
right.
So and I love that you took the initiative to become a nurse for multiple reasons. One is we all know that there's a shortage of them, and
Mhm,
so they flip like pancakes out there. So as an owner, that's got to be hard to manage, to make sure the
mhm,
philosophy and everything is backed. And for families, what a relief that they'll be a mainstay in this
mhm,
position, because it is such a critical position, in the scheme of things, in terms of assessing people and making
mhm.
sure the plans are correct. And again, most of us don't know that till we have to dip our toe or get pushed into the pool because
Right.
we're not going there. And so it's just so much easier if we're educated ahead of time, and if we can connect with people that we really trust. Um,
Exactly. Mhm,
Understands what's going on, and it's evident that you're passionate in this area by all the education that you've taken, and that
mhm,
you are systematically passing down to your staff. A lot of times in companies, and people in the industry understand this, families I don't always think do, but somebody can say, "Oh yes, we've done this, or I've taken this," but that doesn't mean anybody else in the crew knows any of this stuff.
right.
And and that's the critical piece. The whole team's got to be on page and understanding and working as a team, which I think is
Absolutely.
one of the things that we've lost, significantly in all businesses, because of
Mhm,
our micromanaging and not allowing people to be creative. And that's a question I'd like to ask for you, because sometimes companies are so strict they disempower their employees to make a judgment call on how to handle something. And it might be a totally new way of approach. How do you look at that?
I actually want to give them the tools, and then they're the ones that are working with the client day in and day out, and ask them what they think is best. And, even if people make mistakes, or, they made a choice that maybe wasn't exactly the right way to go, I always say, where was their heart at? What were they hoping to gain from that? And usually the caregiver will say, well, it was attempting to help the person to understand that he has people that care about him. And I said, okay, that's great. Let's think of some other ways to do that. I am very open to, because I love to learn. I also think that's how most people get better and evolve, is they learn. You can't shove things down people's throats. You have to give them the information and then an actual physical opportunity to try. We do a lot of role playing here. And, people are like, oh gosh. But really, I'm talking about basic role playing, like, you're in the home and this particular situation happens. I want you to, and I give them a script. How do you walk through what happens? And that's actually where most of the care is needed. I created a customer service type of training, because caregivers get customer service training when they go to fast food, when they go to all other kinds of places, but I don't really know of a lot of agencies that do specific customer service care, because you're in someone's home. There's a lot of nuances there. Like, Mrs. Smith doesn't like it when you put this garbage bag in there. And it's not about the garbage bag. That's what I like to say. It's about, they like it that way because they don't have a lot of control. And this is the one thing they know that they like. So let's do it,
And they'll hopefully know where it is if you put it where they want it to, when they've been doing it for 40 years that way.
Right.
And so, but it's little teeny things that says, I respect you,
Mm-hmm.
and I'm here for you. I'm not here to change you to meet my needs. I'm here to support you to meet your
Right.
needs. And that's a huge, huge difference.
And that's the key. And that's what we hire for. We first hire for empathy. And then I always tell people, like, we can train you. We have people on staff. I can train you how to use a Hoyer lift. I can train you how to change a brief. Not that I would send somebody out that's brand new, but we can train on all these things. We have a skills lab at both of our offices, actually all three of our offices. And we have people come in and do those things, because I want you to get the kinks out before you go to a client. And also, where does your head need to be at? Like a nurse would, like, what supplies do I need first before I start replacing this IV? And we may not be doing IVs in the home, but we may be changing someone's brief, and we need a number of different items to do that. Some of it's critical thinking, and some of it is just like customer service and how do I handle uncomfortable situations. I'm finding that more and more and more is something that needs a lot of training. And that's not just in my business. I see that all over the place.
Well, and when a staff is competent, customer or whoever you're serving is going to feel much more comfortable. And
Right.
it's like, they really don't know what they're doing here, and then the tensions rise and people get snappy. And yeah, that's something easily that you're able to control if you get them thinking ahead. If you are changing a brief and you don't want poop all over the walls, maybe you need everything set and ready to go and smooth, so you're not walking away and someone's like, this isn't fitting me, and starts digging at things. And it's a very simple thing to be able to work with, and it's very respectful, and it
Mhm.
saves time, and it lessens stress on all parties.
Yeah. One of the other things in empowering the caregivers, you had asked, like, how do we do that? I also, from the get go, say, you are our eyes and ears in the home, and you really know how to take care of your person best. So I am going to reach out to you after you go to the client a couple times and update our care plan. And I want you to call us. And we do that as a matter of our process, but the caregivers really know all the details because they're there day in and day out. And so obviously there's some conflict that sometimes comes up, but our care plans are updated by we lean on the caregivers as well. They're the ones that are doing the work, so they know best what to do. And usually there's a breakdown when the caregiver doesn't understand the person or can't maybe get outside of their own space to, and that's not just with caregivers in professional world. That could be certified nursing assistants in hospitals, that could be nurses in hospitals. um,
That
One
could
of the
be
things,
family.
yeah, that could be family. And one of the things I'd like to see, and I'm noticing there are specific geriatric floors in the hospital, but a lot of times our people that come to us come from like a med surge floor and then a rehab, and they live alone. They're given all this paper with this discharge paper, and they will say all of your follow-up appointments are here. You have to call these people, and then here's all your meds. The nurses are doing their very best with the limited amount of time they have, but that I've seen it in they're very overwhelmed and they're like, yeah, I just want to go because I don't want to pay for another night in the hospital. It's really hard for people to listen when they're stressed out.
Mhm.
And, in order for them, it would be nice to have what we do when we go into the home. We sort of help to educate on, okay, looks like you have follow up appointments. And we will even do that for a family if they want it. If there's an adult daughter or adult son that wants to do it, of course, we will support that. But there are a lot of families that don't live close.
Mhm.
We just had one of those. The mom lives here in southeastern Michigan, and the daughters and son live in California. And mom has some fairly acute needs and needs some nurses and things in the home. And it's overwhelming. They're also reeling from a recent death, and they're also reeling from, other things going on top of their own grief. And it's very difficult, to traverse that. I think that it reminds me, I did some like wilderness training. I used to take kids outside and do like camping and stuff. And somebody said, "What kind of leader do you want?" And we all raised our hands. I said, "I, want a democratic leader." And they said, "Okay, how about if you were on Mount Everest and you had to put an oxygen tank on, what kind of leader would you want then?" I said, "I would want someone to tell me exactly what to do."
Yep.
In a nice way, of course, in a respectful way, but sometimes people just need more direction. And if you have that level of expertise, I mean, it's the responsibility for us to help people with it and explain not just how we fit in the puzzle, but how the rest of the puzzle fits. You're going to need to go to your follow-up appointments. Um, you know, the doctor may not recommend hospice. This is what we see. Maybe you could get a hospice consultation.
Mhm.
We do all those things, and it's always what's best for the client and what's best for the caregivers in terms of for the client, and then what's best for everybody together. Those are the order in which we make those decisions, and then include the family in it. We've even met with families here in the office to talk about some strategies for dementia. What I see the most difficult is a spouse that has been supporting their loved one or their wife or husband with dementia for a long period of time, and they're just toasted. I mean, there's no way you couldn't be toasted after 10, 20, 30 years. And it's really hard for them to break out of, this is my wife. This is exactly what I'm going to do every time. Something simple like when you leave the house, there's a caregiver there. My suggestion is you just go ahead and leave and then come back. And because every time you announce that you're leaving, your spouse is getting upset and agitated, and it turns into like behavior problems. We have to kind of adjust to where they're at. And it's still difficult. I mean, I'm not 85 yet, and God willing, I will be 85. I'm sure that I will be the same way. It's very hard to think outside because you're also stressed out and you're also myopic in terms of this is what I need right now. And trying to open people up to see something different can be difficult sometimes.
Definitely. And that spouse issue, I I refer to it kind of like a mom with a toddler. It goes, I can't leave because they need me. I can't go because they, well, they're always going to need you if you never leave. I mean, you're setting that up, you know.
Right.
And I can see where some people want to be around the first couple of times to make sure everything goes
Hmm.
okay and that there's a comfortable fit. But sneaking out is okay, you know,
Yeah.
if that's what needs to be done, or going and taking a nap and just laying down, you know, though they probably have
Right.
one ear open and aren't going to get any sleep. But again, it's still that separation, you know, of
Hmm.
them feeling safe, because it's hard to have somebody come in your home. And so
Yes.
often it, you know, I hear from people in my support groups that, oh, we either I or she doesn't want or he doesn't want somebody coming in the house. And then the other thing is money. And so they wait and 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 they wait. And then they're like, oh, I'm at my wits' end. We have to do this now. And then they get frustrated sometimes because not everybody can implement things like today or tomorrow. Sometimes it might be a week or two to make sure you got the staff
Right.
to fill the hole. And they're not prepared for that. They just think a magic wand's going to, you know, go
Right.
whoosh, and the good fairies showing up at the door, and it'll be resolved. So there's that. But then typically what I hear, even after the 1 to 2 times they come out to the house, is, oh my gosh,
Hmm.
why did we wait so long to do this? They have no
Hmm.
idea the emotional impact that the journey has taken on both of them, and and what a relief it is
Hmm.
for both sides to get refilled. You know, I think of
Hmm.
I'll give the example, and this wasn't home care, but it still kind of fills that picture. My mom had moved into a nursing home, and I had a really hard time placing her there, but she actually asked to go because my dad was there, and that's a whole nother story. But she had a moment of clarity, and after 49 and a half years, she didn't want to leave him. And so she moved out of my house there, and I just had all this guilt, like, you know, why didn't
Hmm.
this work? Why didn't this work? And one day I walked in and they were in one of their great rooms, and there was an activities person that had like an Oprah magazine, and it was spring, and it unfolded to 4 pages, and it was all garden and flowers, just these
Hmm.
beautiful prints. And there was 8 of them all having this discussion about the colors and their gardens and their plants and what they smelt like. And I remember standing in that door going, I could never give that to her because I'm not a peer.
Right.
I'm her daughter. And you know, it's just a whole different environment where
Yeah.
they can relax and they can feel connected. And I up until that point, I thought I understood that, but I really didn't until
Yeah.
I saw it. And then
Hmm.
it was like magical.
Yeah. Social connections are so very important. And I think you hit the nail on the head with bringing in, whether it's getting them to like a daycare or something like that, so they can have a social outlet, or having someone come in the home sooner rather than later. Because if you've met one person with dementia, you've met one person with dementia. They all have their own. Like my mom is a unique individual. She's an artist, and we would put that in her care plan if she had care, for someone to talk about that. Um, unless it became an issue for her, because I could see her going, well, I can't do that anymore, right? And that being stressful.
Mhm.
But you have to get to know an individual in order to take care of them. And I think it's very difficult. People call us in, they're like, well, dad is wandering and hitting people now. Right. They call when it's so bad to the point where they have to now be placed, and they're having a hard time being placed as well because of different
Because
behaviors. Yeah.
yeah,
And if what I love is a family, and this isn't, it's not love so much as that it makes more sense. We start you off with a few days a week. We just come over and help you with errands, or we take you to the mall, we walk around, whatever that is. And then we age in place together. So now that you need us and you're at home and you're homebound and you really are maybe even bedbound, you've had a relationship with caregivers and you know they're going to be there for you, and it's a little bit easier. Um, and you don't have to struggle so much. uh I mean, we can de-escalate behaviors, but typically those are difficult to do. And then if my mom has Alzheimer's, that's my mom. I'm never going to be able to put on a different hat, you know. She's my mom, right? That trumps everything. And I can I could create a care plan for her, but somebody else would probably do better, like doing that care plan for her. So I think people get nervous. And isn't it nice just to be a daughter or a son? I think that's one of the things we tell families, like, go have coffee with your friends, go do something so that you can give back. You can't completely bleed yourself dry and then expect to be, fresh and able to deal with getting mom dressed to go out, and
Yeah.
it takes 2 hours.
We've trained ourselves to be so task oriented that we don't look at the approach of how we're doing it. I know I created a tool called Your Memory Chip, which anybody can download from Alzheimer's Speaks in our free resources. But I created that because I was a witch to my mom one day and I snatched at her. She repeated herself 45 times in 10 minutes, and I didn't think it was cute. I didn't think it was funny. I didn't have the patience. I was trying to get us both out the door and I
Mm-hmm.
lost it. And I was just like, I was so ashamed. I felt so guilty. It was horrible. And of course, my mom forgot about it, but I
Right.
didn't. But I interviewed people all around the world, both staff and family, and asked, how do you do this? And
Mm-hmm.
staff said, well, I have a job description, and family said, well, I have a to-do list. And I was like, yes, good. I do too. And then about 2 months later, I woke up out of this dead sleep in a total panic, just like heart attack panic mode, going, I missed something in everyone's answer. And the funny thing was, it wasn't a word, because we get so reliant on words being our
Mm-hmm.
communication. It was a twang in the voice that said, this isn't how I pictured my life.
Yeah.
And what I realized in that moment is we can't give as much as we think we are,
Yeah.
because as human beings, we protect ourselves first, consciously or unconsciously. And so I kind of had to unrattle all of that and go, I got to look at Maslow's theory and go down to the base, and what's really important to my mom. Is she safe? Is she happy? Is she pain free? Those are the basics. You wipe up all the fluff, gets out of the way. Focus on that first, assess that first, and then apply your task.
Right.
And that might be sitting on the couch, not saying a word, but just being in the presence of somebody
Mm-hmm.
that's comfortable. So it really is this big shift for family caregivers. What do you think are the things that they often don't realize that support services can offer them?
There are a number of different organizations that will actually provide, there's all kinds of programs that will provide actual financial support, like for companies like ours. The VA, the Veterans Administration, we are a vendor for them, so you can get services paid for there. The other thing are the daycares, adult daycares. Some of them did shut down during COVID, but for the ones that are still around, those are fantastic. Or your local senior centers, they always have something. And let me tell you, you don't want to get in the middle of a bunch of seniors sitting there waiting to have a euchre game. And we would come out as professionals and come talk to them, and they're like tapping their fingers, waiting because they want to play euchre with each other. I mean, that's like some serious stuff right there. And um, there are all kinds of stuff. I think a lot of times what I've heard some of the clients say, they're like, well, I don't want to go there. It's all old people. It's
Yeah, our
just,
perceptions of who we are is really
yeah, well,
weird.
yeah. And honestly, we all view ourselves as 10 to 15 years older. That's just kind of how we're built.
Mhm. You mean
And
younger?
yeah, yeah, sorry, younger. And well, I guess it depends on the day, right? But we all look at ourselves that way. But the thing is, there's lots of stuff to do, and the people that are going to senior centers are pretty spry. Those are people that are getting on the buses and going to the museums and things like that. I think it gets hard when the person is your world gets so small in your home. You don't go out, everybody brings you stuff. Getting them outside, having them sit out in the fresh air, you would be surprised how much of a difference that makes. Or just having them do some movement. If they can't walk, doing some gentle movement with their legs. Movement is huge. And that, unfortunately, that is when that gets taken away, kind of everything else doesn't work as well. But yeah, that would be my suggestion. And also the ALS Foundation, some of the other organizations, many of those organizations provide some financial support for caregivers.
Now we've kind of talked about some of your strategies to build skills for your
Mhm,
workforce and stuff.
mhm.
Was there anything else that you wanted to add to that? I love the role playing. I loved you letting them have the flexibility to make a decision, and
Mhm.
then have that conversation. That is probably, I think, one of the best skills of a leader. I have a friend who I still see who was my boss back when I was 20, and I'm almost 67 now. And she did that, and she would say, hey, if you have a complaint, she's like, I'm willing to hear it, but come in with two or three solutions, and she'd make
Mhm.
us think about how we're going to improve this. And she would always say,
Right.
I'm not going to guarantee we're going to change that, but I need to hear that. I need to know where you're coming from, and we need to get it on a priority list if you think it's a problem. But again, as a business, you got to look at big picture. But that really helped me grow and reframe things, that you can't just sit
Yeah.
around and complain the whole time
Mhm.
about something. And then it also brought ownership to the employees. Like,
Mhm.
wow, that was my idea. And then somebody actually got credit for something and it was spread. It wasn't like, well, corporate decided this. It was like, no, Sally came in with this or Matt came in with this, and we can all do this now. And
Yeah.
that's a critical piece of building a team and being able to maintain staff, I think.
Well, and Lori, I'll tell you, we have really evolved as, I own the business with another woman, and we have really evolved in that area. I mean, when we first started, because I was a caregiver, I would like run out and do this. And basically, you need to call the billing department. I'm going to put that because we were small. And as we've grown, I've stepped back and said, I trust you. You can do this. And if you need help, you can ask me, but I'm not going to give you the answer. It's a little bit growing pains. If people are allowed to make their own mistakes and actually provide really good feedback and maybe changes, they start to feel part of something bigger. And I think that's what we have here is they feel part of something bigger. We have two things that we do. We have little kudos that we send out to the admin team every week, and we do a shout out. We do shout outs in our team meeting every week. And for caregivers, we call them the Sunflower Awards, where we will actually document in our system if someone picks up an extra shift or does something really amazing. And we will describe that. And then we also post that in an online newsletter to let them know. Um, it's really easy to pick out things that are wrong. It's a lot harder to stop and go, you know what? I really appreciate that you did that, because you start to see more of that behavior. Most people that get into this and want to do caregiving are heart first people. So they thrive on that affirmation, and they want, it's always difficult when a caregiver goes, well, I don't think they like me. And it's like, it's not about you. They're probably just feeling uncomfortable after coming home from surgery or whatever it is. But if you can make them feel comfortable, then that's what we're looking for here. I mean, we're called comfort keepers. So we certainly don't want anyone to say, I feel really uncomfortable when your caregivers come over, right? So we that would not be good for business. But I think that everybody should be allowed free reign to do what they think is best, because they're caring for somebody. And I don't want to micromanage all that. I mean, of course, if there's something that goes wrong, we're there to take care of it. But it's something I've learned that I need to step back and not jump into everything, because then it takes away an opportunity for someone else to learn and grow. And that's, if you're not learning and growing, you're going backwards.
Yeah,
It's kind of that simple.
I
Yeah.
agree. And when when something doesn't turn out right, if we say it's a failure and then people just start getting more timid at like, well, I'm not even going to try,
Hmm.
instead of looking at it as a learning lesson and okay, what's the next step to still improve care? Because if you look at any entrepreneur, they have failed a zillion times over. They will tell you they've failed way more than they've succeeded.
Yeah.
But it's that persistence of knowing in your heart it can be better, and then to
Hmm.
be able to feel like you're part of that change is pretty amazing. And that's one of the
Hmm.
things I love about what you're talking about in your approach to your staff, because that's to me a make or break thing. And do your staff share with families like techniques and stuff that they're using or philosophies and things? Because like, I'm
Yes.
glad you're shaking your head, because to me that's so important as well.
Yeah, it's one of those. It's like a ripple effect that we want to give them the tools they need, and then I will say to the caregiver, "Have you suggested that to the daughter or the son?" And they're like, "Yeah, I did." And sometimes they say, "Well, they don't really want to do it that way." I'm like, "Okay, but I appreciate you trying." And I feel like that is what we all should be doing. We have, I don't know, over 100 caregivers and over 90 clients, and if we're not here to help each other kind of down the road and get to where we need to go, then what's the point? I mean, yes, we can come in and physically help with these things, but also partner up with our own expertise. And some caregivers that we have working for us been doing this for like 20, 30 years. I mean, they have a lot of experience. That's all they've ever done. They have a lot of good knowledge. Sometimes we have to mold that knowledge into new ways of doing things, like transferring people so they don't hurt themselves. But yeah, absolutely, it's important for them to educate the families, because there are a lot of misunderstandings about, for example, like, someone will call and say, "Well, can you lift my dad from this to this?" And my dad weighs 350 pounds. I'm like, we will not be deadlifting your dad. What about a Hoyer lift? What about, so we talk through those things. I don't want anyone to get hurt, and I also want to do things. It's going to be more detrimental if someone falls and gets hurt and breaks something than it is if we get a Hoyer lift in the house or something like that. So it's just this constant. A lot of people have old understandings of how things are done, and we don't deadlift anybody. And I always train the caregivers, if you're having to lift somebody off of something like all their body weight, that's not what we're here to do. Um, so that's one of the misconceptions. I think a lot of people call our company and say, "Well, I can't lift them up. Can you come lift them?" Like, you need to call a lift assist from EMS and they'll do
Mhm.
that.
Well, I know here in Minnesota they're talking about charging like assisted livings, because assisted living and some memory care isn't even lifting people up. And they're
Right.
calling and they're like, no, 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 you're paying for that. So some of them are, some cities are starting to charge because it's so routine
Yeah. Hmm.
and things like that. So it's complicated, but it gets down to safety,
Yeah.
and the person can get hurt and the caregiver can get hurt and others can, get hurt as well. You don't want that. Now, given your background in leadership and education, I would imagine there are some things in the healthcare system you would like to see tweaked
Hmm.
regarding our older adults and caregivers.
Yeah. The one that comes to mind that seems to happen over and over again, we're sending people home with discharge paperwork. The daughters and sons now have to all of a sudden become like case managers or nurses. And you know what? It's not for everybody.
Mm-hmm.
There are some people that are amazing. Like, I've met a couple daughters that, like, I mean, they're like, "I could come work for you, couldn't?" I'm like, "You could. You very much could, because you've learned all this on your own." But not everybody wants to do that. They want to pay a company to come in and help them with, what meds are we supposed to take? Like, for example, there was a woman who came home that had 3 different opioids she was taking, and then was, like, not using her walker, and explaining to the family like why that's dangerous. I would say that that's the biggest gap I see. There are some like newer companies coming up, like case management type companies, And again, that's more money that people have to pay. But I think, yes, we have home health care where the nurse will come out, but the nurse may not come out for 2 or 3 days. What is that individual going to do for 2 or 3 days while their medications are sitting in a bottle?
Yep.
Right? So I don't know how to fix that, but I know that having someone actually there to do those things would be very helpful. And that is one of the major reasons why I'm going to get my RN, is because I can help do that. I understand there's a home health care company that comes in, which the difference is that is nursing, that's physical therapy, occupational therapy. They come in for a short period of time, maybe once, maybe twice a week, and then they're done. Once the prescription is over, the doctor wrote, it's done unless you appeal it. And for us, we're there all the time helping with the trash, the mail, the meals, all that laundry, all that stuff, and helping mom get from one place to the other. If they don't have kids that live close, and that happens a lot, like my parents, they live in Dallas, um, that turns into some of that coming back into us, and then us saying, do you want us to handle this? And then you have the client who's like, no, I've been doing it myself. So there becomes this struggle, and then they don't get to their appointments. It doesn't happen. So we have to have a strong team going in with the family, with the client, and like all talking to each other together, which is why we do an assessment to begin with. I think that's the biggest thing, and really paying attention to the meds your family loved one is coming home with. Really pay attention. Like the as needed meds end up becoming every 4 hours. And not to say anyone's addicted to anything, but like if you're taking a strong opioid every 4 hours and you're trying to get up and go to the bathroom on your own at night, you may end up back where you started with a broken hip or something. And that's a whole other set of troubles. I think that's the biggest thing. And I know a lot of people are like, well, it is what it is. If it happens, it happens. So,
Yeah.
um, it's a lot of wear and tear on families when people are going in and out of the hospital, and they
Yeah.
get frustrated with it and they start to feel guilty. And they're like, I had someone tell me mom's been going in and out of the hospital for like a year. And I'm like, okay, let's see what we can do to keep her home. I think that's the different statement we need to make. Hospitals used to talk about keeping people out of the hospital because of money and Medicare and all that. I think we should talk about it from a health standpoint, and talk about it from, if mom does go back into the hospital or she gets pneumonia again, how can we prevent that at home? We can
Mhm.
use the incentive spirometer. We can talk about those things. And a lot of that is nursing education. And you don't have to be a nurse to do that, but a lot of it's nursing. Or, Miss Smith, you've had pneumonia. Let's get you up and walk with my help so that you're not sitting in a chair all day and all that is sitting in your lungs and you're not getting that fluid out. We need to have that kind of conversation with people in their homes, rather than, I can do your dishes on Tuesdays and Wednesdays and I can do your laundry on Mondays and Fridays. Yeah, all that stuff's important. But more importantly, we need to be, and I hate to use this because everyone overuses it, but like patient focused, client focused on what do they need to get stronger and better. Or if it's hospice, comfort care,
Mhm.
and educating the families on that, because there's some misunderstandings on that. Like people on hospice are like, he's going to get better. It does happen, but I
Mhm.
also don't want him to get hurt while he's trying to get better.
Yeah, I think
Um,
there's a lot of common sense that needs to come back home into the
yeah.
clinics and the hospitals, because I've been, my mom's been gone over 10 years now, but I have another family member now I'm dealing with. And like one time, they went and brought her back, and they would not let myself, who's caregiver, and her husband, who was kind of ill and frail, come back with her. Well,
Hmm.
they're not getting any
No.
accurate information at all.
Nope.
And I really, I went after the doctor. We met like 3 times. She kept coming out, and I said, no, this is ridiculous. This is a waste of an appointment. And your
Yep.
staff set this up by saying, no, she doesn't need you. And your staff, your RN pulling her back, or LPN, doesn't know the situation.
Right.
how to change that. Or, they'll give discharge information even just after, I don't care if it's a physical or whatever. But what I've noticed now here in Minnesota, where I go, both to hospitals and to clinics, they just hand you the paper.
Right.
There's no discussion. Nobody has any time, and people need that discussion because it's too much. I mean, I can read through it, but not everybody can handle all the information, because now they're adding all the AI stuff in, and it's like a booklet. And so
Right.
it goes on, a nightstand or a coffee table in its place there, but no one
Yeah.
really knows what it says, or they'll miss
Hmm.
those appointments. And in the hospital, they're so urgent to kick somebody out that is absolutely ridiculous. You have to fight tooth and nail,
Yeah.
because there are so many assumptions made. With my ex-husband, we kept him in, I think it was like a week and a half longer, because I fought. I'm like, you
Hmm.
can't send him home. He cannot walk six steps from the chair to the bathroom without assistance.
Right.
And he's on oxygen. Well, he's got oxygen at home, but no one's listening. He's not used it but twice in a year.
Right.
Well, he's got a 50-foot cord. That's a tripping hazard.
Right.
And he's got a dog and a wife with dementia. Hello. No.
Right. Right.
I mean, talking to the social worker, talking to the durable equipment people, talking to the hospitalist. I mean, and most people don't have that time or
Right.
that knowledge that they can even question those things. So pulling you
Right.
guys in
That's perfect. Yeah.
is really important, or even having the correct paperwork for family to be able to access the portal and talk and make it, because they have different forms for everything, instead of just packaging them and going, this is everything you're going to need.
Right. Everything is in a silo. So it's like, okay, this is my piece of it. And it's not any of the the medical staff's fault, because they're
Mhm.
just doing what has been built in the system.
Yep.
But the system could definitely better care for geriatric patients. Doing a clinical in an OB setting, that is set up very nicely, where kind of the whole family's involved, everybody's in the same room. I understand it's birth, it's exciting, but why not do something similar for the geriatric population, where you can have, and there are a lot of places that do this well. I'm not saying
Mhm.
all places, but an RN that's got six other patients is not going to have time to explain everything. And not only that, but if you have dementia, are you going to remember anything that the nurse said once you get home to your
Yeah.
independent living facility? Yeah, you and I are definitely in agreement on that. And it's hard because Medicare is not going to cover that.
Yep.
And that's where you have to private pay for a company to do that. For me, I like to roll it in all to one, so that
Mhm.
you've got a company caring for you, and then you've got the company at home and our services where we can make suggestions.
Wonderful. Well, I can't believe we rode through an hour already here. Is there
I
any last minute thing that you want to add in that we haven't covered?
No, I would just say that for me, the biggest takeaway that I have from learning all about this is that there definitely is a skill in connecting with people that have illness or dementia, and that's really the most important thing. It's easier to take care of somebody, just like if you have children. I have children. It's easier to take care of them if you're connecting with them, instead of, did you do the dishes? Did you do the dishes? And I understand those are children, but it's the same thing with any human being. It's important to connect so you can help them, meet them where they're at.
Exactly. So we have been talking with Lydia White with Comfort Keepers in Southeast Michigan, and we want to make sure that you get the contact information, which is CK and then farmington.com. And you are also on Facebook and Instagram, where they can find you, and we will have all that information posted for you as well. But, gosh, I've really enjoyed this conversation, Lydia, and I appreciate so much where you're coming from in terms of how you've pulled your business together and how important education is, and flexibility and adaptation, and getting to know the person you're caring for before you just start implementing things. Because like you said, when you know one person with dementia, you know one, but when you know one caregiver or one caregiver family, you know one. We're all
Right.
different. So,
Right.
all of those things have to be taken into consideration. I would also like to encourage people to be a giver of hope, like click and share this episode. Your sphere is so important to spreading the word. People don't even know what to Google. And when they do Google, they're getting the top ones that paid to be positioned
Mm,
there. That doesn't mean
right.
it's a great match. So here on Alzheimer's Speaks, we like to have real conversations with real people that are in the thick of things. And everybody has different ideas and different attitudes, and are all over the world. But they're, I think, easy conversations to listen to, and hopefully it will bring somebody comfort, not only coming from you, as somebody in their community. It might be family, friend, or it might be a colleague. It might be somebody you don't know. But the
Mhm.
more we can put information out for people to reach, the easier it's going to be for them to grab it when they're ready. Because
Mhm.
there's a lot of denial around this disease, and around, and around caregiving as a whole. And so, we would love you to be a giver of hope. Doesn't cost you any money, takes very little time, just a click away. That's all it is. And then I also like to give a plug for Q for Good, who is my webmaster. If you're looking for somebody who actually is on time, economical, and a good communicator, they are absolutely fantastic. I highly recommend them. And then again, please visit Alzheimer's Speaks and Dementia Map for all of our free educational resources, and you'll be able to find, products, service, and tools there as well. So thanks, everyone. Till next time. Bye now.